Hello, my name is Mark Tarallo, and I am 63 years old at this recording. I've been a patient with Dr. Bilowus for a little over 5 years now, and I would like to tell you about my particular experience with high-intensity focused ultrasound, or HIFU as it's called, for the treatment of my prostate cancer. I'm recording this in March of 2017, and it's just about 4 years since I had the treatment, which was done in March of 2013. Initially in 2012, my primary care physician noticed that there was a spike in my PSA score. It had gone from 1.8 to 3.9 over a period of 6 months. And having already been a patient of Dr. Bilowus, I went to him to see what the situation was. And he was very conservative in his approach initially. He said that we should rule out the possibility of an infection, so he put me on antibiotics. But that did not improve the PSA score, so the next option was to do a biopsy. And that's when we discovered that I had cancer in multiple locations of the prostate. Fortunately, it was still contained within the prostate, but I had a Gleason score of 6. My wife, Vicky, was with me at the time of the report, and we immediately discussed what my options were for treatment. And as I'm sure you know, there's a whole list of things that can be done for prostate cancer. But we were very interested to hear that Dr. Bilowus had been involved with this program that was researching the treatment of prostate cancer with HIFU. And another plus was that he was way out in front of a lot of other doctors who were just coming up to speed with learning about this particular procedure. I was happy to hear that the post-operative complications for HIFU were what I think Dr. Bilowus said to me was they were 6% incontinence and 12% ED. My main concern was continence. I did not want to have a problem with incontinence after having a prostate procedure. Also, the fact that it was non-surgical was a plus for me as well. So we decided right then and there to go with HIFU. The treatment was done in Nassau because it was not approved. The HIFU device and the treatment was not yet approved in the United States at the time. So amazingly enough, a whole team of doctors, nurses, and technicians, we flew into Nassau. Dr. Bilowus flew in, and I had the procedure done along with about half a dozen other patients from around the country that had come to get the procedure as well. I was under general anesthetic, or under general anesthesia, and during that time they completely ablated the prostate with the HIFU machine and also inserted a suprapubic catheter just below my navel. After coming out of the anesthesia, I was wheeled to the front door of the hospital, which I basically could have walked. I was taken home, or actually taken back to the hotel room, and I rested for about an hour. Dr. Bilowus came to see me to make sure that I was doing okay. He did a quick check of the little surgical spot where the catheter was, wanted to make sure that that was okay. And that evening, Vicky and I walked to the harbor, had dinner at a restaurant. After dinner, we walked up and down the harbor for a while, and 2 days later, we flew home. I wanted to mention that I had the procedure done on a Saturday, and the following Thursday, I was able to urinate without the use of the catheter. And about a week and a half later, I no longer needed it, so Dr. Bilowus removed it at his office. I'm happy to say that I've had no problems with continence, but I did have ED for several months after the procedure. That has reduced significantly, and I can say that I'm pretty much back to normal. And the only other problem that I had was about 9 months later, around December of that year, there was a blockage, which significantly reduced my ability to urinate. But Dr. Bilowus was quickly able to remedy that problem with just a minor outpatient procedure. Since then, my PSA score has been less than 0.1, and that has been for 4 years now. And Dr. Bilowus has said that there is no evidence of any disease. So if you're in the same situation that I'm in, that I was in, it's an amazing procedure. It's not invasive, literally non-surgical, and the recovery time is minimal. And I am living proof that the procedure has kept me cancer-free for the last 4 years. So if you're a candidate for HIFU, I highly recommend it, and I wish you the best of luck. Thank you.